I'm Dr. Preston Parry. I am a board certified OBGYN subspecializing in reproductive endocrinology and infertility. I'm passionate about helping people build their families, as is the whole team at Positive Steps Fertility. And we just want to help people have the children of their dreams. So we're going to focus today on a lot of questions relating to age and how it impacts one's chances. So the first thing is, does age affect fertility? And there are a lot of people who get pregnant without problems as they get older. Many women who've never tried, they do completely fine when they're trying to conceive for the first time. But the thing is, the longer you go, the lower the chances. 75% of women normally get pregnant in 3 months when they stop contraception. So when you have people who are older wanting to conceive, it's not just that they're older. It's the fact that often they've gone 2, 3, 10 years. And that's much more concerning. But that being said, age matters. When you're 25, most of your eggs, 80, 90%, are chromosomally normal. But when you hit 40, 3/4 of your eggs are abnormal. What that means is if you're trying to get pregnant for the first time at 40, only 3 months out of the year will you have a fair chance. So age absolutely affects it. This is why you can often be really aggressive for medication to help people get extra eggs when they're 40, because if you get 4 eggs in a 25-year-old, they're about to be the next Dr. Bomb and have a reality show and have a basketball team and all those crazy things. But if you're 40 and you need 3 or 4 eggs to find a normal one, that means the risk of multiples is often less, and you can be more aggressive safely. So age matters, but it's not an absolute barrier. Another top question people have is, what is the biggest risk of age for impacting fertility as you get older? And I would look at it 2 ways. One, there's an impact to whether you get pregnant, and the other is, what is the health of the pregnancy itself? Now, again, for the chances, people, if they've gone a year and they're 40, they're often running a 1% chance per month. So age definitely has an impact. But then if you're 25 and you've gone a year, you're at 4% a month. So it's not just about age. The longer you go, the more you have to evaluate and possibly rev things up. The other thing is, what is the health of the pregnancy? And as you hit 40, you can see that the rate of miscarriage can even be 40% or higher, depending on how long the journey's been. So that matters. The other thing is there's a higher rate of chromosomal problems. That's what can lead to miscarriage, but it can also lead to things like Down syndrome. And at 40, you can often see chances where people talk 1 in 100, 1 in 150, roughly, for a pregnancy at term having Down syndrome. And so this is something that is increasingly common. And so this is also where it's not just enough to get support to conceive, as well as you need more evaluation to confirm whether the pregnancy has any problems. So coordinate closely with your physician when trying to conceive a little bit later in life. Everyone is always asking, how do my eggs change over time? And they absolutely do decrease. Every woman actually thinks they lose 1 egg per month. You actually often will lose about 900 per month, about 30 a day. And only a certain number of those can be rescued. If you give $5,000, $6,000, $7,000 worth of medication all in a month to just say, how can I get as much as possible? At 30, you'll often be able to rescue about 25 eggs. At 35, it's often about 16, and about 40, it's often 8. So you can see those numbers start declining over time. So time absolutely matters if you're trying to rescue everything as much as possible. But the other thing is, it's not just, again, the quantity of eggs that can be salvaged, but also their quality, where, again, you go from 75% normal at 30 to about 50% normal at 35 to about 25% normal at 40. So both quantity and quality decline. Now, some women have quantity, some have quality, some have both, some have neither. It can vary. My wife, we had fewer eggs at 41 when we had Lucas. We were pretty low for our reserve, lower than normal for our age, but the quality ended up being really good. So this is one thing where you want your clinician to evaluate the quantity, but ultimately quality. The only way you really know is a blend of successful pregnancy or sometimes IVF with PGT, where you biopsy the embryo to find the normal DNA. Another thing people often want to know about is, are there more risks to pregnancy as we get older? And of course, there's risks for the number of eggs and whether they're chromosomally normal, as well as whether people will ultimately conceive. But another thing people are looking at is, hey, does my age affect whether I'm going to have complexity with the pregnancy itself? And the older you get, the more issues you can have. You can develop fibroids, which are growths in the muscle of the uterus. You can get polyps, which grow in the lining of the uterus. There are infections and other things that can accumulate with time. But the other thing is, pregnancy itself can be harder. And this is from a blend of not just age, but people can have weight that they've gained over the years. They can get high blood pressure, diabetes, all kinds of other medical conditions that can lead to prematurity. And they can have preterm labor. They can have preeclampsia, which is best described as an allergic reaction to pregnancy that affects your blood pressure, and also some problems with how protein is broken up in the body. And so it starts having it so people get swollen. There are lots of things that can affect your chances and your health, as well as that of the pregnancy as you get older. And this is something really to coordinate with your obstetrician, your fertility specialist. Sometimes, if you have a lot of medical conditions, you'll even meet with maternal fetal medicine, which is a person who's trained in general obstetrics before going on to specialize in high risk obstetrics. At what age do you run out of eggs? That is a great question. And the answer that's always right in medicine is it depends. You can see some women, bottom 5% of women at birth, have the same number of eggs as the top 5% do at 40. So there's an enormous range for how many eggs you can find for women. I think the easiest way to think about it is say it's on a continuum. You should be evaluated individually, but quantity and quality evolve over time. Another thing, just for fun, is to look at super fertile women and what are their chances. And you take this religious group known as the Hutterites. It's a sect, Montana, North Dakota. They have no contraception, no STDs, and a lot of intermarriage for things. And what they find is half of women who have 8 kids on average can't get pregnant past the age of 40. And so there are a lot of women who are super fertile, and even then, time starts taking a toll where things can't happen past 40. So I think everyone should be mindful of the biologic clock ticking. If you are 25 to 30, most likely you've got some good eggs. But again, if you're wondering, it means things haven't happened, and often evaluation makes sense. But at the same time, the older you get and closer you get to 40, often in your late 30s, your fertility is going down by 20% a year or 1.5% a month. And as you get into your 40s, it can be 2.5% for 30% a year or even more. So definitely keep a mind to age. At what age does the risk for pregnancy complications significantly increase? The answer is, again, it depends on your overall health. I see some 40-year-olds who are healthier than 25-year-olds. So it's not just purely an age or a number. I think the 35 cutoff is a bit arbitrary, and there are a lot of women who do very well at 38 who are healthier than some women at 28. But ultimately, you have to look at it as a blend of your overall health and your age. And the more you have one or the other, the more it matters. So definitely talk with your OB or your fertility specialist if there are problems that might make you worry you're doing worse than average for your age. Why does fertility decline as you get older? Great question, and it affects so many women. The number one reason is you ovulate your best quality eggs first. So this is called the production line theory. You release your earliest generation copies first. So think of a game of telephone. You're 2 people down the line, you get the message, you're 20 people down the line, you have no idea what the first person said. So this is why 2025, most of the eggs that are released are normal DNA. But as you go on over time, those eggs end up being later generation copies where there's more of a chance that a mistake happened over that time, where you've got extra DNA, missing DNA, that can lead to miscarriages, that can lead to birth defects. This seems to apply much more to women than men in this particular way. Now, it affects men too, but men tend to have these point mutations. Think of a book. You look at, a chapter, a page, a paragraph is missing. That's often for the women because every egg they have, they were born with. Men, they make new sperm every day of their lives. And so it's a different type of mistake where it's continually repleted. These are sort of more the point mutations, which instead of a chapter, page, paragraph, it's more a sentence, word, or letter. So they're very small and they're harder to detect. This is why if you do PGT, it's a way of making embryos with IVF and biopsying the embryo to see if they're abnormal. You can actually find a lot easier mistakes that originate from the egg than you can from the sperm. Did you learn something from today's videos? If so, please like and subscribe down below. Follow us. We will provide as much information as possible for general knowledge. Also, if you have topics that you want us to talk about, please let us know just right below and we'll add those for future conversation. Again, I'm Dr. Preston Parry. If there's anything we can do to help you on your trying to conceive that TTC journey, just let us know. But don't suffer alone and in silence. Get answers, get peace, and hopefully have that family of your dreams.